Hi everyone, this is Saran. I'm here today at the Mennonite New Life Center, who's one of the community partners for the Social Innovation Project we currently have at Humber. And I'm with Tracy here today. Hi Tracy.
Hi Saran. I'm good, thank you. Welcome to the center. Thank you for coming.
Yeah, thank you so much for having us. Can we start with where we are? Can you tell us a little bit more about the space?
Oh, sure.
Yeah.
So we're at 2737 Keele Street, which is Keele and Wilson. The Wilson bus line is one of the busiest in the city. We've been in this place 15 years or so, maybe a bit more. And right now it's our link hub, our language instruction for newcomers to Canada. So we have 2 link classrooms for people that are in person, as well as some online classes. And one of the most fun things about the space is we have a childminding area. So when parents are coming to learn English, they don't have to worry about what to do with their kids. Their kids come along. I believe right now it's ages 6 months to 5 years, like not 6 years, 5 years and blah, blah, blah months. And we have a nice space where kids can interact with toys, and there's a lead childminder who leads activities for sensory activities and things that are age appropriate. And so the kids learn English, the kids learn to interact with other kids of different cultures, while the parents are learning at the same time.
Wow, that's super fun, and it's really helpful for the parents too. Like, I definitely see where that could be, present a barrier in some ways to parents to have that time and availability.
Yeah.
So aside from the classes and the child minding area, what other services does your organization provide?
We offer holistic view of a person who comes to Canada. So we take into account all of the things that they might need. So starting from the very beginning with things like, I need a house, I need clothes, I need to get my kids enrolled in school, I need food, I need a driver's license, like all of these very seemingly basic things, we will support with that. And then we also continue supporting throughout their journey. So a next step for people quite often is learning English. So we have the LINK program and the LIGHTS program. And then finding a job is another key factor in making a comfortable life in Canada. So we support with building the skills to find the job that you need. So there's training on what your goal is, short, medium, long-term goals, and how it interacts with your life goals. So we'll work with people to use their skills that they brought with them and to find a job that's meaningful for them. And sometimes it means following their previous career. So we have some bridging programs that bridge internationally trained professionals who had skills and experience in a career in their country of origin, and they're coming to Canada and they want to continue. So we have a mental health bridging program and a media and communications bridging program. But then sometimes when people come to Canada, it's a really good opportunity. They're kind of starting over again. They can start over again in something different. And so we have a couple of bridging programs that offer a change to what you might have been doing in the past. And one of them is is for women in IT. So taking, skills of logic and problem solving and turning it into a QA analyst kind of career. And then the other one is taking your immigration experience. Every immigrant has an immigration experience. So taking that experience and turning it into a career, supporting other immigrants and newcomers or cultural communities that need that kind of help. So those are another thing. And then the last thing is wraps around everything we do is mental health. So whether we call it mental health, whether we call it emotional support, whether we call it transitional support, something to help people come to terms with the losses that they experience, whether it's people, job, friend, identity, grief that they've lost these things, to come to terms with them and to see hope. And that's something that's really key for newcomers, is that there is a place for you here. There is you do have value, you are wanted, and how can you have the confidence and the hope to continue and to make a life for yourself here. So that's something that we offer as well.
Wow, that's really fantastic, and it's so needed as Canada continues to welcome more newcomers.
Yes, yes.
Yeah, so I'm also curious, what led you to this organization? What drew you here? Yeah.
So I have a varied career path. I started, my background is in math, and then I was at the Ontario Medical Association teaching, leading a program that taught physicians how to use computers. And then I got tired of doing that after 8 years, and I took an ESL class, ESL teaching class. And then I was working at an ESL private school for 8-ish years, and I wanted to have something more meaningful. At that point, I was teaching kids. It was super fun. I was teaching young adults who were coming to Canada to learn English and to party a little bit and to explore their freedoms, and then use English in a non-English speaking environment back home. So they needed English, but they didn't really need English, right? So I wanted something a little more meaningful. I started volunteering for an organization called Skills for Change as a language mentor. So people, I worked with an engineer, I worked with a nurse who just, wanted someone to talk to and practice their English skills and connect with somebody in the community. And I did that because I wanted to see if I liked working with newcomer community and if I wanted to get into the sector, and I really did. Like these people that I worked with had such rich and interesting lives and perspectives, and so that led me to the center where I used my language skills to teach the cultural communication class for the bridging program for mental health professionals. And then from there, I was hooked. I got into an outreach role, and that grew into a communications role. And so now I'm on the leadership team and supporting the decisions that we're making to make an impact on the community.
Oh yeah, that's fantastic. Can you tell our audience a little bit more about the program? Like, for example, what is this room versus?
Yes. So Mennonite New Life Center does a lot of work around education and skills development for newcomers that come to Canada. And this classroom actually is a LINK classroom, language instruction for newcomers to Canada. And it's also a LIGHTS classroom. So LIGHTS is one of our innovative programs for language instruction, giving hope to trauma survivors. So it's for people who've experienced trauma in some form, either in Canada or in their country of origin, and their brain isn't open to learning English in the traditional sense. So sitting in classrooms for long periods of time, maybe doing it on the computer, it doesn't work for them. So we have a mental health counselor and a language instructor who work together with the students to do more art-based learning or more hands-on functional learning of the language, so that their confidence increases and they're more likely to be able to go out into the community and have their basic needs met using their English skills.
Oh wow, that's really fantastic. And going back to the research project, can you tell us a little bit about how the collaboration came about?
Sure. So I'm friends with Heidi Christensen, who is the lead on the project, one of the leads on the project. And at one point we were out for a COVID walk, talking about work and the kinds of things that we were doing. And she was talking about her recent trip to Guatemala with Frankie, another of the project leads. And I was talking about my work here at the center, and we realized that there was so much in common, that we don't actually have to leave the country in order to be able to support people accessing health care. And so we started brainstorming and rolling things together, and that's how it got started.
So basically, one of the outcomes of the research project is building this health clinic. So what are some highlights of the project you're looking forward to through this collaboration with Humber College?
We are super excited. As a newcomer organization, we have supported newcomers in various different aspects. So we have a holistic viewpoint of a person. When they come, they're not just a person that needs a service, they're a person and they have hopes and dreams and feelings and all these things. But one of the things that we have struggled with in the past is connecting people with the health system. So clients don't often know, newcomers don't often know what the health system is like. It's really hard for them to navigate. Sometimes staff have problems if they're a newcomer themselves and a staff member. They haven't necessarily figured out the system yet either. So, and as you know, the health system can be challenging for people to access even if they were born here. So we've struggled getting referrals to family doctors and that sort of thing. So we're really excited to be able to have the student nurses on site, seeing a client from head to toe, having the client be able to talk to the nurse about what the challenges are. Even being heard is a really important part of this experience.
Mm-hmm. Wow, that's really fantastic. And what do you hope as a community partner would be the impact of this project in the long run? In the long run, so a short term I think would be for us to build our capacity to be able to connect better with the healthcare system. And I know that some of the research assistants that are on the project are working pretty hard at making connections and integrating in the connections that we already have. So we have an understanding of who we can reach out to. And then longer term, like longer term, would be for us to advocate for removing barriers to healthcare for our clients and newcomers in general. One of the things with the study ortho needs assessment that we did, that the nursing students helped us with, was to find out what clients need. And clients, we thought a number of our clients that would respond to the survey would have been those that don't have any health, don't have a solid status in Canada. But it turned out that a lot of the people that responded were permanent residents or Canadian citizens who have access to OHIP, but they still don't know how to get the help that they need, or they feel that they're being discriminated against, that the care that they're expressing, their concerns, and they're not being taken seriously. So we would like for that to change, of course, and we see ourselves as a big part of that with the help of Humber. Yeah, that's really fantastic. So for you, so this is one of the social innovation projects that we have at Humber. So for you personally, what does social innovation mean to you? So for me personally, I would say it means changing the way things are done, that's the innovation part, around how our systems and processes are structured, and making sure that they change in a way that that comes from the people that need these things changed, that they have a voice in making the changes to how our society is structured. Does that, I don't know, what is the official definition? Do you have a Humber definition? I think it's fair to say that there are so many different definitions that there are no right or wrong definition, right?
Yeah.
But as long as it's making a positive impact on the community, that's what we're passionate about. And we're really impressed, honestly, by the number of services and how it really takes into account the different needs, the different backgrounds of the people who are newcomers to Canada. And you've been working here for quite a while now. So do you have a story of someone or like a story that's close to your heart that really showcases the impact of the services?
One really recent one that actually Humber was also involved with, Heidi and Frankie participated in, was a COVID-19 vaccination clinic. So early in the vaccines availability, everyone was fighting to get it, right? And people who were being able to access it were not the people that needed it necessarily, right? And we knew that many of our clients were working those kinds of frontline jobs, and they are in vulnerable multi-generational housing situations, close quarters, vulnerable people, that children and elderly parents all in the same. So we knew that they needed the support. So we worked really hard to get an early vaccination clinic in partnership with Humber River Hospital across the road and with Humber College with the support of Heidi and Frankie. And we served 500 newcomers in one day at a vaccination clinic in like April, I think, of 2021. It was on Vaccine Hunters that like so many people were trying to get into our clinic. We were turning people away if they weren't newcomers. Like our priority focus was newcomers. Mm-hmm. So it was fabulous for them to be able to get it so soon. And that's the impact that the center can have on our newcomer communities and what partnerships do for us, right? For us to do it alone, to do many of the things that we do, for us to do it alone is really difficult. But once we engage with innovative partners, then we're able to do amazing things.
Wow, that's really great. And yeah, like the availability to have it and access for people, that's really important. And we're really grateful that the community centers and like organizations exist like this to enable this for our community, really. Mm-hmm. We were also curious, has your organization previously participated in a research project like this in the past?
No, not to this extent. We have worked with academic partners for bridging programs, to do smaller pieces, but not in a project of this scale. This is a multi-year project that's going to have a big impact on the center, and we'll be able to use this research for to share with the sector and also to advocate for more of these kind of support services for people to access the healthcare system. So we're really excited about it.
Wow, we're excited about it too, especially about the impact it will have on so many people's lives. Mm-hmm. And to end the interview, I want to ask some fun questions. Mm-hmm. So can you tell us maybe about your favorite movie?
All right. So I wouldn't say it's necessarily a movie, but it's a series on Netflix, I think it was, called The Bridge. And it's set in Europe. I forget which two countries, but they're connected by a bridge, and a murder takes place. I don't know why I love murder shows, but I love European murder shows. So it takes place on a bridge, and they find a body, half in one country and half in the other country. So they have to involve the police forces from both sides to solve this. And it goes over a series, so I'm not going to tell you the answer, of course, but it's pretty fun. The characters are pretty fun, and it's interesting to watch the European take on things for me.
Wow. Yeah, thank you so much for sharing that.
Yeah.
So when you're not working, what are some things you like to do in your free time?
I love to play Ultimate Frisbee. I don't know if you've heard of that. Yeah. So we have some leagues in the city that we play. I've been playing for 25-ish years and excited to still doing. I'm a little bit injured right now, but once I get back to it, I'm really looking forward to getting back to it also. Mm-hmm. And I foster kittens. That's also super fun.
Oh,
yes.
Fun.
Yes.
And what's your favorite place in Toronto?
You know what? I love Toronto. I'm from a small town, and when I was coming to Toronto as a kid, I thought, what is so exciting about this? It's a big city, and all there is like glass apartment buildings. And I would go to the CN Tower and the Sky Dome and like the CNE, and that was it. And then one day we were going to the Jays game, and we took a wrong turn, and we ended up in a neighborhood with houses and stuff. And I was thrilled. When I first came to Toronto, one of the first things I did is I took this Queen streetcar from one end of Queen to the other end of Queen, and it was so much fun for me, like to see all of the neighborhoods, like going along busy shops, and then quiet, and then like another neighborhood would come out and it would have a different character. And the flower shops, I love the flower shops, and the fruit stands that are like so accessible. It was so different from any other city that I've lived in. Yeah, so I can't say I have a specific spot, but I love all of the little local spots that you can immerse yourself in.
Exactly, exactly. And also what makes the city great is community organizations like the Mennonite New Life Center, who really make such a positive impact to so many people's lives. So
thank you.
Thank you for the work that you do.
Thank you.
For your partnership with Humber College.
Thank you so much. Appreciate it.
Thank you.